think everyone's definition of a migraine is so different.
Yeah.
The way someone might define a migraine is probably very different from the way another person might.
Migraines are just like bad headaches.
I mean, they are bad headaches. They are terrible headaches. I'm saying these are throbbing headaches.
Yeah.
So
they're just saying just
headaches.
bad,
Yeah, bad head, bad day. You've had a bad day. There isn't one thing that has been identified to be a cause for a migraine. And for that reason, there isn't a thing that you can do to stop yourself from having a migraine.
Welcome to Consultation Room Podcast.
Welcome to today's episode. On today's episode, we'll be discussing a complex and debilitating neurological condition that affects millions of people worldwide, migraine. So today we will unpack what migraines are, explore their causes and triggers, and discuss the latest treatments and management strategies available. So whether you're a migraine sufferer, a caregiver, or just curious about neurological health, this episode will provide you with valuable information and support. So, Trudy, to start off, what is migraine?
So as you said, it affects millions of people worldwide. And I think everyone's definition of a migraine is so different.
Yeah.
The way someone might define a migraine is probably very different from the way another person might.
Yeah.
Now we'll get into that. But just basically, a migraine is basically a throbbing headache, and you feel it on one side of the head. So you'll feel it maybe at the front or maybe on the side, but it literally does happen on one side of the head.
Yeah.
And it usually lasts 2 hours to 3 days. So there's people who have 3 days of migraine, but there's people who might have 2 hours of migraine, and then that's it. That's their migraine attack done. And in some people, it can occur several times in a week. So they could have maybe the 2 hours one day, and then a couple of days later they might have another 2 hour attack, and maybe a couple of days later they might have another one. Whereas some people might have 3 days, and then that's it for the month, or that's it for, I don't know, a few months. But as I said, it's definition of a migraine is very different from if you ask people who suffer from migraine, they will say it in a very different way.
Yeah.
And it does range from mild to severe. So there's some people who have severe migraine that literally gets in the way of everyday life. They cannot do anything. Where there's some people, it's mild, they will use some treatments or some ways to manage it, and they should be able to just get on with life. And as we said, it can feel very different to each person. Yeah. So we will get into all of that, but that is the definition of a migraine. Right. And people have different symptoms when it comes to a migraine. Yeah. There's some symptoms that one person might have, and another person who has migraine might not have the same symptoms. Right. So talking about symptoms, what are the common symptoms of a migraine?
So as Trina mentioned, the symptoms ranges from different things, and it can affect different people different ways.
Yeah.
But the most common symptoms it's the severe headache, which you already mentioned. Also, when people describe it as a throbbing or pulsating, usually occurring at one side of the head. That's definitely a common one that usually happens. The next one I would usually say is nausea and vomiting. So some migraines are usually accompanied by these gastrointestinal side effects, nausea and vomiting. Not everybody may get that, but again, as we said, it may vary in different people. Another thing about migraines, which is a common symptom, is sensitivity to light, to smell, to sometimes loud noise, loud sound. That's one of the symptoms. When it comes to migraine as well, there are times where you may get a warning signs before migraine. So you may get some symptoms that may warn you that the migraine is coming on. So some people may get maybe a stiff neck, or sometimes get like craving to certain foods.
Yeah.
Or maybe even like feel really thirsty, or going to the toilet a lot, or sometimes even the mood changes.
Yeah.
Yeah. And we do also have something called aura. And this is usually quite common in migraines, where some people get warning signs such as flashing lights, zigzag sensory disturbances,
Yeah.
Zigzag patterns, blind spots, or tingly,
Yeah.
like pins and needles in your hands or face.
Yeah.
Or sometimes they may even feel dizzy or difficulty speaking. So this aura, it usually occurs in about 1/3 of people suffering from migraine.
Yeah.
They may get this aura symptom. But as I said, not every symptoms that every patient might experience.
Yeah.
And with like migraine, there are different types as well. So although I have said some patients may experience some aura, other patients may not experience it. And we have said that it also usually comes with like severe headaches, but there are some patients who may just get just the aura and no headache. So yeah, and you may get maybe both. So there are different types of migraines out there. So just watch out for the symptoms and watch out for the warning signs as well. So with Trudy, since we've been through the symptoms, I know there's a thing where we usually say migraine has no causes.
No.
But what are the triggers, or what may bring upon like a migraine?
So, yeah, that's right. Migraine does not necessarily, I think it's not well understood as to what could be causing migraine, but it doesn't mean that there isn't a reason why you could be getting a migraine. So genetics plays a really big role in migraines. And I say that to mean if, say, your family members suffer from a migraine, the chances that you might also suffer from a migraine. It is almost hereditary. So biologically, it can be passed on, and that could be a reason why you're having migraines. Now, just to understand exactly what happens with a migraine. So it occurs when, so basically when you have a headache, this specific headache that causes a migraine, specific nerves in the blood vessels send signals to your brain. Okay. Now, this releases inflammatory substances in your head's nerves and blood vessels. And that is what causes that migraine, that throbbing, as we said, throbbing headache. So as we said, because it is something to do with sort of like a specific nerves, and we know when it comes to like genetic, you inherit a lot of these things, that could be the reason why you're having a headache. So hereditary factors play a big role when it comes to headache. Also, I think they say that depending with we'll probably get to that shortly, triggers, but some people might find that some things will cause them to have a headache or might trigger their headache. So not necessarily it's cause you to have the headache, because as we said, it's not very well understood what could be causing your headache, but it would almost trigger that headache. So it's almost like a cause, a cause, but not quite. And 80% of people with migraines have vast degree biological relative with this condition. So as we said, genetics plays a big role in why you could be having migraines, but also other things. So other conditions could actually cause you to have a migraine. Maybe we'll speak about that slightly later, risk factors, but some conditions can cause you to have a migraine. So sometimes they say things like depression can actually cause a migraine, but for now I think it's just it's very important for us to understand that there isn't one thing that has been identified to be a cause for a migraine. And for that reason, there isn't a thing that you can do to stop yourself from having a migraine. You can avoid, as we said, triggers, which we'll get into shortly, because as we said, there's things that can trigger the migraine, but it's not a matter of, okay, this is what is causing it, so if I cut it, then I won't have a migraine. Because again, when it comes to triggers, we always say someone might have a trigger today and then tomorrow it'll be a different thing that triggers. So things like that might happen. Now, talking about triggers,
Yeah.
what are the common triggers?
Yeah. So, as Trudy has rightfully explained, there are different triggers out there.
Yeah.
The common one, which I would like to put there first, is stress.
Yeah.
I feel like stress is it's such an important thing when it comes to a lot of like health diseases. It causes it triggers a lot of like diseases. Let's put it out there.
Causes a lot of things.
Yeah.
Let's be honest.
So when you're stressed, it brings upon so many things, honestly. And yeah, migraine is one of them. One of them. The other thing I would put, as Trudy said already, certain foods and drinks. I'm not sure if you've heard this, but they said with migraine, some like aged cheese.
Yes, aged cheese. Yeah,
can trigger like people's migraine. Even chocolate.
Yep.
Yeah.
Yeah.
And also when it comes to drinks, if you do take in a lot of like alcohol, a lot of caffeine, these are all like triggers for migraine.
That's it.
And if you're someone also who likes to indulge in maybe, let's say, red wine, and you do find out that, okay, you do suffer a bit of migraine, that is a trigger as well. So, yeah, just bear that in mind.
The fact that you mentioned red wine, because red wine is actually fermented grapes, isn't it?
Yeah.
You know, so anything fermented also can actually trigger your migraine. So if you're a migraine sufferer, you know, just try to avoid anything that's fermented or pickled, because again, it's like aged cheese, that is a fermentation process. So anything that you have to leave to sort of like, you know, cure, so even like cured meats and things like that, avoid it.
That's right.
Yeah.
That's right. The other triggers I would say, I mean, talking about food, not eating like regularly, or skipping meals literally like trigger your migraines. Let's put it that way. I don't know if I told you the other time when I was doing the no protein.
Yeah.
Like literally, I wasn't eating regularly, and even I'm not a migraine sufferer, but I did get headaches quite often. So you can imagine, as a migraine sufferer, if you're going to be missing your meals or not eating regularly, that can be a trigger for it, because you're not getting that energy, you feel tired and things. Another trigger I would put out there is hormonal changes. Let's say, for instance, you're starting your period, that could trigger a migraine, or even pregnancy and menopause. So these three, they are triggers for migraine. When it comes to environmental factors, which Trudy mentioned, can be like a trigger as well. I would put maybe like bright lights, loud sounds, you know, strong smells. There are some people where, like, you know, it does really trigger their migraine. So if someone does tell you, oh, please keep the noise down, you know, or dim the lights, do understand maybe they might be like a migraine sufferer, and there's a reason why they're telling you that. Sleeping patterns as well.
Sleep is important.
Lack of sleep can really trigger a migraine, because just think about it, you're not getting that amount of sleep that you're supposed to get. Your body's tired, you feel drained. That could easily trigger a migraine. So make sure you're getting your regular sleep.
That's it.
Literally physical exertion as well, like you know, you feel really tired, maybe not exercising enough as well, can literally trigger a migraine. And there are, I think you mentioned there's some risk factors, but some diseases such as like anxiety and depression can also like trigger migraine.
Or even, I think, being sort of like having some of these conditions, it will almost cause you to now start having migraines, and then you'll have other triggers, including being, you know, having this condition as supposed to trigger. But it's all about, I think a lot of things is all connected. You know, it's all the CVS system, so it's all about, you know, sending nerves, isn't it? So when you talk about something like depression, anxiety, it's all, you know, and then it's a nervous, it's a central nervous, central nervous conditions. So, as we've said, migraine is to do with that as well. It will it's almost like interlinked, isn't it?
Other things that I would say could be a trigger could be also like medications. Some medications. So those are the common common triggers that I would put out there.
Yeah.
You did mention there are some risk factors,
so, I mean, the risk factors is we've kind of
literally
mentioned them,
yeah.
So,
but anything that I've missed off?
no, I don't think so. I
Yeah.
mean, we have said, that hormonal changes or hormonal imbalances is something that can actually really highly trigger or cause you to have a migraine. And we all know there's estrogen, progesterone, and they play a big role in biological functions. So if there's an imbalance in these two, it could trigger your migraine. So anything to do with the hormonal changes. So if there's an imbalance in your hormones, for whatever condition we're talking about, all kinds of conditions. Even sometimes if say, how we take, women take HRTs, contraception, that might imbalance your hormones, and that could actually trigger your migraine as well. Right. So those are the risk factors. So when you're on, I always say this, when you're taking or you've started new medication, speak to a healthcare professional. Exactly. Make sure you understand the medication. And you know how we always say the health checks are so important.
Honestly,
this is why. Because if you go for your annual check, so we're talking about the reviews that you always get called for, regardless of what they are. If you go for these reviews, and blood tests, as we said, is something that will probably be done, isn't it? They will pick on some of these things. So if there's an imbalance in your hormone levels, they will pick on this, and then they'll try sort of like just balance that out a little bit. So it's very important always, if you're called in for your annual MOT, go for it. And I think the others you've mentioned, so the likes of like depression, anxiety, sleep disorders, epilepsy, these are conditions, again, it is all to do with the central nervous system, so they will be a risk factor for migraine. I think I can't think of any, but if you're a migraine sufferer and there's a condition that triggers your asthma, we haven't triggers your migraine and we haven't mentioned it, please get in touch with us, and then we can maybe put it out there as well. Or if something that is new that you have gone to the doctors and they keep saying to you, we don't actually know anyone to suffer from this or to have this as a trigger, please get in touch with us. We'd want to also just learn a bit more.
Exactly.
So
Fantastic.
So I think we've talked about sort of like the symptoms, the what could cause it or what could trigger it, if anything. But there is treatment. So it's a way to manage your asthma. So there is normally management with every condition. There's going to be a way that you can manage it. Now, we're not saying that this will cure it, as we said, because it's not well understood, and because we don't understand what causes it. There might not necessarily be something to cure it, but there will be something to treat and manage your migraine. So just over the counter, the only thing that there is available is sumatriptan. So over the counter, I mean, there is, of course, the likes of naproxen, omeprazole, paracetamol, aspirin. These are analgesics that you can get in a pharmacy. But on top of that, the only triptan available is sumatriptan. Normally you have to do a questionnaire when it comes to sumatriptan. When you're getting it in a pharmacy, you have to do a questionnaire. So you have to have a chat with the pharmacist, and if everything is fine, then you'll be given the thumbs up to take it. What about non-OTC medication?
So when it comes to non-OTC medications, there are some. So let's say, for instance, if your over-the-counter medications are not working, so the analgesia, the triptans, sometimes you take some medications for like nausea and vomiting. If these options are not working, we usually advise you to go to your GP so that they would give you something stronger also. So there are, even with the triptans, there are higher strengths. The one over the counter is a lower strength.
I think it's only 50 milligrams, isn't it? Only that is the only one that is available.
But on prescription, you could get a higher dose.
That's it.
And it actually comes in different forms as well. It comes in tablets, it comes in nasal spray. The nasal spray works a lot faster than like the tablets. There is actually injections for triptans as well.
Yes, there is.
And there are different triptans, but for over-the-counter, as Trudy mentioned, is literally just the sumatriptan. There are some cases where if these analgesics and triptans do not work, the GP might refer you to a neurologist just for their input and for something stronger. So you may find out that some migraine sufferers may be on maybe the likes of antidepressants.
Yes.
They may be on pain relief such as pregabalin or gabapentin. These are very strong medications, but they are only prescribed under expert advice. You would never see a GP, or it has to be from a neurologist.
So you'd have had to be referred to them.
That's when and all these options have literally not worked. So those are the prescription medications that were put out there. But apart from these medications that we've mentioned, there are some non-treatment managements that we can't do.
That's it.
Some lifestyle adjustments that people can opt for just to help them. Because if you look at the triggers, by looking at the triggers, you can use that as a management to help you either prevent your migraine attacks or even help you treat it. So lifestyle changes like regular sleep, which we mentioned, eating healthily, managing your stress.
That's it.
Some people actually do go for relaxation techniques,
meditation,
just to help them, help them relax, or even acupuncture. Acupuncture as well helps people that have migraine attacks. So if medication is not working for you, these lifestyle changes may help. The main things we usually say when it comes to these sort of things, if you can identify your trigger, just avoid them, just to help with the migraine.
That's it.
And
I don't know if you've had this, Steph. So, I mean, as you said, there is normally medication management of a lot of conditions, and we've talked about non-medication management. But have you heard about Botox?
Yes.
A lot of people actually get Botox now, but not for the purposes of getting, being wrinkle-free and getting rid of, the lines on the skin. But it's actually for headache.
Yeah,
for migraine, sorry.
When I used to work in the hospital, we used to do a lot of prescriptions for Botox. And literally migraine was one of the indications for it. So
I mean, and I'm glad things like this. I'm glad we actually are discussing things like this. The reason I say that is sometimes when someone says, I've had Botox, the first thing you think of is, oh my God, let's be honest, as a society, we think, I'm sorry, how shallow of you, why do you know what I mean? But you don't realize why someone might want or need a certain treatment. Some people use Botox for migraines. Other people use it for excessive sweating. So, exactly. And Botox is not, I think it's the stigma behind Botox, isn't it? Over the years, it's been made popular by, let's be honest, celebrities who literally one day, they've got wrinkles, the next day, they're wrinkle free and, they're looking younger and all of that. But some people actually need it because it is a medication, let's be honest. Botox is actually not just a substance that you inject because, it's not just a cosmetic injection for, I suppose, for beauty purposes. It's actually a treatment that a lot of people use for other things. That's Botox is actually something that helps a lot of people. Okay. And I think you mentioned all the others. So acupuncture, meditation, yoga as well. So yoga and meditation, if you're a migraine sufferer and you've got a friend who's been inviting you to go yoga, maybe it's about time you take them on that invite. Just because you never realize some of these things. Anything that relaxes your mind, keeps you calm, might actually do you so much more good. So definitely. But I think that's about it.
We've mentioned most of it, and if you're someone that suffers from migraine, I think you usually adopt things that for yourself, like individually and personally,
Yeah.
just to help you. Like some people may go to like a dark room when they have a migraine, just to help them calm down, like get the migraine.
Yeah, especially if you're having aura, if you're having a migraine with aura, so light might actually kind of like trigger or make it worse. Getting getting that rest in a dark room might actually be what you need. That's right. And that will actually help you with managing your migraine.
And literally staying hydrated as well, and literally cutting down like the alcohol and caffeine. It's a big thing for migraine sufferers. It actually helps.
It does. And I think also a lot of migraine sufferers, especially the ones that I've encountered in pharmacy, they do actually buy a lot of like the compress, the hot or cold compress, and they put it either where the front of the head or wherever they're having the migraine, or the back of the neck, because we said you get that stiff neck. That actually helps them. So if you're a migraine sufferer, we might want to maybe try some of these things, see how it helps you, really, isn't it? But definitely, like, there's ways to, I suppose, cope with a migraine. So as we said, it's not really something that's going to cure it, but it will help ease the severity of it. And also just scalp massages. When you get that scalp massage, let's be honest though, when someone is giving you a scalp massage,
it feels good.
It does. Like, it could be a hot day and you get that little massage and you're like, yes, this is exactly what the doctor ordered. So yes, scalp massages. Also just, the temple of your head, just going round there in circular motion, because that's pretty much a massage, isn't it? It does help. So I think just doing what you feel will help you is the key here. So as I said, for everyone is so different. So someone might get that cold compress or hot compress, put in their head, and they'll be like, this is much better. And someone else will do that and they're like, no, this is not working. So you just understand your migraine. I think that is very important. Understanding your migraine, understanding what triggers your migraine is very important.
Fantastic.
So
we've been through quite a few things now. Let's just move to the bit that I like. Talking about the myths out there, the misconception that people have. I like going through these things just so that we can debunk some of these things myths, and literally set the facts straight.
That's it.
So we'll just name a few of like the myths that we came across. So I'll start off with this one. It's an easy one. So what I came up with, they say migraines are purely psychological. What do you think?
That is not correct. No, it's not psychological. And a lot of people say that. They say, I'm sorry, but she's just, I'm sure, it's all in her head. It's not that bad, but no, definitely not.
Thank you. I think that you literally just said it right. It's not psychological. As we mentioned before, it is a neurological condition. It does involve like literally complex changes in like the brain and nervous system. And it's not just a reaction to like an emotional stress that people think are going through.
That's it.
Sometimes they're like, oh, it's because she's emotional or she's going through some mental health changes or something. No,
or the association of it with like a period as women, isn't it? They're like, oh, it's just that time of the month.
Literally, I was my second myth.
It's because it's something that a lot of people say, isn't it? So they're like, oh, is it the time of the month? She always says she gets a migraine, but no. There's no acting here. There's no Hollywood, that has been done here. It actually does happen.
What about you? Did you come across any?
I think my main one, and I think I won't say it's a myth, but it's something that I've had questions in pharmacy about. So a lot of women in pharmacy come and buy the sumatriptan, Migraine, which is what we have in over the counter. And so a lot of like the same male dispensers, I was like, is this like a woman thing? Because it's only women who buy this. So I think there's that misconception or myth that it's only women who will suffer from a migraine. But unfortunately, no, it's not just women who will get a migraine. Men and women can both get migraines. But as we said, hormonal changes can actually cause you to have a migraine or trigger your migraine. So let's be honest. Women, we go through a lot more hormonal changes, hormonal imbalance. So that time of the month, the same myth we've talked about where they say it's that time of the month. She's just, it's just in her head. When they say that time of the month, you're having a migraine, it's because your hormones have changed. That they're haywire, they're all over the place. So as we said with estrogen and progesterone, because they both play such big biological functions in the body, with that being messed up, it is likely that could trigger your migraine. So it is not in our heads, to start with. And secondly, not just women will have a migraine, because as we said, there's a lot of genetics can actually be a reason for you to have a migraine. So it's not just passed genetically to women. Men and women can both have migraine. And children as well.
Anyone,
and children. Anyone of any age.
Exactly. It can affect any demographic. So it doesn't really pick and choose. No, it's just gonna affect women. No. Even children, honestly, get referred to neurologists.
That's it.
Some young kids are getting migraines, and you're like,
I think with children, the reason I think people would have that myth or misconception as to what a migraine is and who it affects is because sometimes children don't really know how to explain what's going on.
No, but believe you me, that's what I thought, And my son, my firstborn, used to there was a time he was complaining that he was getting headache. And I was like, how can a little boy literally know that he's experiencing headache? But we do need to listen to them.
No, I'm not saying that they will know how to, they will know that there's a headache, but it's one of those, it's like my nephew. My nephew could be hot and he'll still play. You won't know until you notice something. Let's be honest, kids are, they're the most amazing little things. And especially when they love to play, they could be hurt. You'd see a kid, let's say, fall and injure himself, and he would get up and keep playing. So it's almost like they won't necessarily explain what is going on. Sometimes, like with my nephew, he had a backache. Why is a 7-year-old having a backache, right? So he was playing football, and then he was like, oh, my back does not feel good. I was like, okay, does he hurt? We had to go then, and then he had to say where there was a pain. And we think maybe he must have twisted himself a little bit funny. But if we didn't notice, because he literally went back out and played. So if we didn't pay attention to that, we might not. So that's what I mean, the reason with kids or people might have that misconception, because kids might not necessarily, because with adults, when you're, say, you can't get to work, you can't get out of bed, you're like, no, this is, this is
always want to play.
So it's like you kind of you'll dismiss, you're like, he's fine again, so you wouldn't actually pay as much attention to their suffering.
That's right.
Because of the fact that they're kids, so that might be that misconception, but children can suffer it, and they will. I think when a child is explaining that they have a headache, we as adults and also healthcare professionals, we need to take that time to have that conversation with them, maybe even involve a counselor or therapist to talk to them in a way that they will be able to explain, and they'll be able to understand what is actually being asked of them, for them to really indicate that, okay. Because they'll say, you ask, where is the headache? Oh, my head, in my head. Where's the pain in my head? They won't necessarily say it's, it's the front part of the head, or so things like that. I think with kids, it can be quite difficult.
It is.
Yeah,
it is.
But definitely, yes, children can definitely suffer from migraines. So with your son, was it a migraine or was it just headache?
It wasn't a migraine, but at that point, the reason why he was having the headache, he actually had a viral infection, so it caused a lot of things. Actually, it was quite serious. He did have the headache, and there was a point he actually couldn't move his neck properly.
Bless him.
And it affected his vision. We thought it was really serious, and it turned out to be a viral infection, literally, that caused that.
Oh, poor boy. But that's, I suppose to get to that, it took a bit of, you kind of taking that step and saying, we need to get this investigated, isn't it?
It was he had a really stiff neck, he couldn't move properly and everything. And I was like, wow, a viral infection could cause that. But as soon as that was cleared, it was fine. All the symptoms went away.
Oh, there you go. Yeah. We thank God for that.
Yes.
Perfect. Do you have any other myths that you can...
No, I think we've debunked a lot of them by just having the discussion.
Yeah.
The other ones were just migraines are just bad headaches.
I mean, they are bad headaches. They are terrible headaches. I would say these are throbbing headaches. So
they're just saying
just headaches.
Bad,
bad head, bad day. You've had a bad day, and
they're quite severe for some people. So
yeah,
they're not just headaches.
As I said, if it's lasting 3 days, that's severe. That gets in the way of everyday life. So if you have a colleague who suffers from migraine, or there's a family member who suffers from migraine, be a bit more gracious with them, because you don't actually know how badly they are suffering. So it's not just a bad headache. It is a headache you could not explain, basically. That's great. So I mean, as we said, if there's any questions or anything that's new that you have been diagnosed with migraine, and there's been maybe some risk factors or triggers that we haven't mentioned or is not even known, and your doctor said, wow, we've never had this, please get in touch with us, because I like to understand some of these things, because if our patients come in, we should be able to sort of like know what is going on by knowing some of these things. Perfect. So what is your take home, Steph, in regards to migraine?
Fantastic. So if you're a migraine sufferer, or even if you're not a migraine sufferer, one thing I would say is get diagnosed by your GP or a healthcare professional first. To clear the air, migraine is not just like a headache, as we've put it out there. It is more than just a severe headache. There's so much more to it. Migraines are a complex and often debilitating neurological condition. It can significantly impact the lives of people. And you may think it's just, it's not a serious illness, but honestly, it is really affecting a lot of people, and it's affecting their everyday life, the everyday activities. So just understanding the diverse symptoms, the potential triggers and available treatments is crucial for effective management of migraine. And just remember, if you are someone that suffers from migraine, or someone who suffers from migraine, it's important to seek strategies and treatment available that can help reduce the frequency of your migraine attacks, because living with migraines, it can be challenging, but with the right treatment, you can have a meaningful life, a comfortable life. You shouldn't have to go through that debilitating headache. So get the right treatment just to help you and improve your life, your quality of life. And what would be your take-home message?
I think you've said it really well. So I'm just going to be very short here. But if you are a regular or frequent sufferer of a migraine, seek professional help for a diagnosis of a migraine, and then have a tailored management plan. So as we said, when it comes to triggers, it's very different, with different people. So something that could trigger your migraine might not be the same thing that would trigger someone else's migraine. So having that tailored treatment plan is very, very important. And I think also understanding your triggers is very important. And also working with a healthcare professional to increase your quality of life. Because if stress is the cause of your migraine, for instance, or the trigger to your migraine, then maybe working around ways to avoid stressful situations. So always work with a healthcare professional, a healthcare provider, maybe your specialist, to try and have strategies that will help manage your migraine. That is very, very important, because I think the end goal here is we just want to improve quality of life, because as we said, migraine can really get in the way of life, and the last thing you want is something affecting your everyday. So it is something that can be managed. There isn't necessarily a cure as such, but avoiding the triggers will, of course, avoid the severity or how frequent you get these migraines.
Fantastic.
Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
If you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week. Stay safe, stay healthy, and stay blessed.